Good morning and welcome to Living Well right here on Metro TV. We are also live on DSTV channel 277 and also on GoTV channel 170. My name is Ethel Poplampo. As the montage showed, it is Breast Cancer Awareness Month. And as we always do on this program, we will be bringing you discussions in that area. So don't go anywhere. You can also join us on Facebook at Metro TV Ghana and also on Twitter at Metro TV GH. We'll be right back. Back from that short break. The show is still Living Well. My name is Ethel Poplampo and it's on Metro TV and also on DSTV channel 277. We are also live on Facebook at Metro TV Ghana. Now, it's Breast Cancer Awareness Month and we are going to delve deeper into the topic, and we hope and pray that we bring you information that will bring light bulb moments into your head and also give you more knowledge than you know already. So stick and stay, don't go anywhere. Today we are going to talk about the fatality of breast cancer. I have two people to help me peel the onions, peel the layers of this topic. Let's take their profiles. When we come back, the show continues.
Profile of Dr. Davis Kofi Adherje. Dr. Davis Kofi Adherje is a consultant obstetrician and gynecologist and the director of Mary Lucy Hospital, Awoshi, Lucy Memorial Hospital, South Afankor, and Royal Medical Diagnostics Center at Awoshi. Trained in the UK and in Ghana, Dr. Adherje is a member and fellow at the Royal College of Obstetricians and Gynecologists, RCOG, UK. He is a cosmetic gynecologist and cosmetic laser physician surgeon. Thus, he is a member of the American Academy of Aesthetic Medicine, AAAM, in the USA. Dr. Davis Adherje is a stem cell specialist and member of the International Society for Stem Cell Applications, ISSCA USA. Again, Dr. Adherje is a cellular medicine consultant and a member of the Cellular Medicine Association, CMA, USA.
Profile of Rosetta Intriwa Boache. Rosetta Intriwa Boache is a registered midwife at the Lekma Polyclinic, Accra, Ghana. She doubles as a maternal and child health advocate, health influencer, and a medical media personality. Rosetta is the Public Relations Officer of the National Association of Registered Midwives Ghana. Through her service, she has been able to reach out to thousands of young girls and women in Ghana, especially in societies that are hard to reach in almost all of the 16 regions of the country, to educate them on menstrual hygiene, cervical cancer, and maternal and child health. She is the founder of Tell It to Rosette. Her outstanding services have won her numerous honors and awards in her municipality, region, and nation as a whole. She hopes to do more to ensure healthy lives and promotes the well-being of young girls and women.
Right, whilst we are talking about breast cancer, we also want to find out what the public knows about breast cancer. So let's take the Vox Pop. When we come back, we'll do the discussion.
And I know that this month is Breast Awareness Month. My knowledge on it, I think I've heard a couple of times, people losing breast, and I just found out this afternoon that some people die from it, but I didn't know about it. And I do test in the house once a while, not that often. I don't really go to the hospital. Nobody checks them, check the right, press it and see if there are any lumps. And I think when you find something, we are advised to go to the hospital to check and then know the next step. So I advise young ladies to try and check it. It's a really deadly disease, and knowing a lot about it will help save a life.
The month of October is usually for the awareness of breast cancer. Breast cancer is a form of cancer that affects the breast, but we have the assumption that it only affects females. But I'm here to tell you guys should also go and test for breast cancer, because breast cancer is really deadly, and then we have a lot of our mothers, even our youth, dying from breast cancer. And one way to check for breast cancer is regular massaging of your breast to check out for lumps. And then there's a procedure for that, which would be shared if you search on the internet for it.
It's when a lump is in your breast, because my sister once had a lump in her breast and she went for surgery. And that's what I know about breast cancer. That is when a lump comes into your breast, it makes the breast bigger. Yeah, that's what I know. And to the government, what I can tell the government is that they should educate the girl child on the effects of breast cancer, the causes, what they are supposed to take, what they're not supposed to take, like in their diet to prevent it.
Don't feel immediately now I have to go to the hospital for a checkup. No one who said if the lump cause that breast cancer and I say whatever. No. Say if they find out after their investigations, let's more find out to say lump they have to. It's the earlier detection, no, prevented the breast cancer.
Breast cancer na ayeba no. Ye nim adokoro so no say they are babebre ekuma ye chichu amanfo nufuo ni ma nufuo nkala nkete mpacho ye pese aban wombo ye na sa yare no entwo so kakra na say they are do so ga na dudu.
Right, there you have it, people sharing their knowledge about what they know about breast cancer. I always say that when it comes to October, there's a whole lot of noise about breast cancer. And as you heard from the Vox Pop, not a lot of people really know how dangerous this is. It's just another condition that you might lose your breast. A lot of people, just as the lady said, she didn't even know you can lose your life from it until recently. That's why we here at Living Well, we are beginning the conversation on how fatal is the condition. Then we can talk about other things. Dr. Davis, thank you for joining me.
Thank you too.
Most of the time when we talk about breast cancer, what comes to people's mind is a disease that can affect your breast and you can lose your breast. Yes, to a lot of women, losing your breast is a big deal. But apart from losing your breast, why should we be worried about breast cancer?
Right. Well, in fact, if it's just losing your breast, then you still have your life, and of course, then you can still carry on and lead a normal life. And these days, people can wear prostheses or have breast, implants and things like that for cosmetic, purposes. So it's not a case of, just losing the breast, but actually life. And it's sad that of the lives that are lost, the vast majority, probably 60–70%, are from low middle income countries. So it is a big issue. And in women, it's the #1 cancer, top of the list. So if #1 cancer and people are dying from it, then we should be, concerned, and we should be acting and doing something about it.
It's interesting you mentioned #1 cancer when it comes to women. But then how common is it in Ghana?
I would say that it's difficult to give you statistics from our part of the world. Why? Because some people have it, and the myths and beliefs that people have about breast cancer, and people will be somewhere, maybe in the rural area, will have a breast disease and maybe tackle it in a different way. So we will not have the statistics precisely, but it is still the #1 cancer in Ghana, and being the #1 cancer is the first cancer killer of our women. Worldwide, it is estimated that about 1.7 million cases are diagnosed every year, and in 2020 there was over 2.3 million cancer cases diagnosed every year. In that year, yes, huge numbers. So it has increased, isn't it? Yeah. And the irony of this is that as it is going down in the developed parts of the world or high-income countries, it is that reason for it rising is from the less developed or the middle low-income countries. I believe you're getting the message. Yeah. So a condition that is going down in other countries, but overall is going up, means the other side is what's contributing to the high.
And Ghana finds itself in that region.
Yes, we are classified as a middle income country, thereabout.
I do understand that studies have not established what really causes cancer, but then breast cancer, I'm also aware it's not only in women, but in men.
Yeah.
In Ghana, as you said earlier, the statistics are not clear due to the way we manage the condition here.
Yeah.
But have there been cases where men come into the clinic and are diagnosed with breast cancer?
But very isolated. Because if you take all breast cancer cases worldwide, then maybe just 0.5 to 1% are going to be men or males. So it means about over 99% occurs in women. So yes, men can also get a breast cancer.
Before the show began, you and I were having a conversation on the back of the topic, and I was saying that a lot of donations have gone into the studies of cancer in general and breast cancer as well. How is research going? What has been discovered? Where are we when it comes to finding a permanent cure for breast cancer?
Yeah. Well, the unfortunate thing about breast cancer is, unlike cervical cancer, where we know it is caused, there's a causative agent, which is a virus, and therefore you can approach the virus and tackle it and reduce the incidence. Breast cancer, unfortunately, we don't know the agents that cause. We don't know what or how it arises. So it's it is. Research is going on how to diagnose, pick it up early and cure it and nail it in the bud. So that is where research is focused, screening. So, and then picking it up means you have to screen the population to be able to pick it up early. And of course, creating the awareness, as we're doing right now, is the main thing. People should be aware about of it. And it's not just the public, but also health personnel. Healthcare providers should also be aware, because it is estimated that some, a significant proportion of health, people in the health sector don't have too much, knowledge about breast cancer, and so we need to tackle it all at the forefront. So in terms of where research has gotten and funding and things has gotten, mainly is screening. And if you look at the developed parts of the world, they have screening programs that they do, for a certain age, mammograms and things. These are expensive. They are not, that affordable in our part of the world. So we just give a simple message that people should be aware of it, and they should just, even just self-examination is probably, one thing that we should be promoting, because at the end of the day, then the patient is, the individual or the lady is the first person to find that lump in the breast, because in the beginning it is asymptomatic, no symptoms, symptomless. And then when you start getting symptoms, it means it's gone.
It's
yeah,
at the
really,
advanced
yeah,
stage,
stage. So.
I understand that it's the situation in most cancers, because last month was Cancer Awareness Month, and we understood that by the time you start seeing symptoms, you are at the advanced age.
Yeah.
And early detection when it comes to cancer is very important. With that, there's a better chance of you surviving. So you coming in early, being diagnosed, and starting treatments is important. You've already mentioned certain demographics where the disease is common. But then are there specific age groups that are prone to getting breast cancer?
Yes, usually the tail end of menopause, so from, late 40s, 50s.
Is there a reason?
Going. Well, we know that the breast is under the influence of hormones throughout the reproductive age. And these hormones predominantly estrogen and progesterone, which are the main hormones that influence the breast during the menstrual cycle. So the principle is the more opportunity the breast has had to be exposed to these hormones, the higher the risk. So if you start menstruating, or if you're what we call menarche, your period starts early, and you're going to have several cycles to and then menopause comes late, you have a long duration of exposure to these hormones on a cyclical basis. That puts you at risk. Pregnancy is said to be protective, so if you have because pregnancies, then maybe, but all these are just relative factors. And then of course, when women generally breastfeed, it's been shown to reduce, the risk. But we're just talking about risk reduction and things, but not prevention of the condition.
Yeah, and when in your delivery, I get most of the reduction of risk geared towards women. But then here we understand that a man can suffer from breast cancer. You said getting to the end of menopause. Is the situation the same when it comes to men?
Yes. Again, with men, we don't get it in the younger. It's not common in the younger age group. So, because during a man's lifetime, as men age, the hormonal imbalance between what the main male hormone, which is testosterone, and the main female hormone, which is the estrogen we just talked about, tends to, increase, in favor of the estrogen. So testosterone, some of it can get converted into estrogen towards the later part of life. And so again, you find that men, as advancing age, then that is when the risk comes. So this is predominantly what we call estrogen or hormone-dependent cancer. And so the more exposure you are, you realize some men develop, quite prominent breasts during later lives. And it's because of estrogen. So, of course, then those men will be a bit more at increased risk than somebody with a flat.
Right. Breast cancer, when we talk about it, we know you might lose your breast. But then also, let me put that out there, that is at the advanced age. If it's detected early, there's a possibility you might not lose your breast. Is that the case?
Yes, absolutely so. And that is the whole point of screening. There are people who are genetically predisposed. So if your sister, mother, first degree, second degree relatives have breast cancer, then it means in that case there's a genetic tendency in the family. And of course, in a situation like this, we're not saying those are the only people that are affected, because if you look at the breast cancer cases, not more than 10% will be genetically based. So it means there's some factors that cause breast cancer, which is not, genetic based, isn't it? But by and large, yes, picking it up early is the key. That is the whole point of, survival Because when it's late, then you're only doing tender loving care, palliation, because it's gone everywhere when it's late. But if you pick it up early...
You said it's gone everywhere. Where everywhere is?
Well, depending on the stage. If it's at the last, final stage, which is 4, then it's gone beyond the breast to other organs, such as, the lungs, liver, brain, that kind of thing, yeah.
So this is an important point you are making. Breast cancer does not only affect your breast. If it's at the advanced stage, other organs might get affected.
Yes, other organs might get affected.
And if you are at that stage and your breast has not been, you've not lost your breast yet, does that predispose you to maybe conditions from the organs that have been affected? Say your kidney. Are you predisposed to a kidney disease if your breast is still there? Or is that the reason why it becomes necessary for your breast to be taken off?
Yes, it's one of the reasons, because if that is the source. But sometimes when it gets to that advanced stage, then taking the breast even will not make much difference, because it's gone beyond the breast. You can, it's gone, for example, to the liver. So you taking the breast at that point, which will be quite, perhaps even not amenable to surgery. Even if it were, you will not achieve much in terms of quality of life or anything, or survival. So in those cases, perhaps we look at it and it's far advanced. The surgery is not going to make any difference. So the key is to pick it up early.
Yeah. When it's
a tiny lump. Then there's a chance that you will not lose your breast, because sometimes you can just remove the lump and the margins around the lump, okay, and you go further, check, or sometimes go further and remove a few of there are lymph nodes where it initially goes to, and then that may be it, and then the breast is saved. So yes, if it's picked or detected early, then the breast, you don't lose the breast.
It's interesting that at the beginning of the show I said, I hope and pray that our discussion will bring light bulb moments in there. Is this why this is happening? And I just had that light bulb moment, because it never made sense why the condition I have is with my breast, and then I have to die. How is that connected to my life? But with the explanation, I understand that it doesn't only affect your breast, it affects other organs that makes you unable to have good quality of life. If you are just joining us, you are watching Living Well. This is our first episode of the breast cancer series in the month of October. Today we are talking about the fatality of the condition. I know you might be wondering, why are you talking about the fatality if it's the first show? If you just joined us because I explained earlier, if we talk about breast cancer and breast cancer awareness, we all know that it's a condition that affects your breast, both male and female, and you might lose your breast. That is all we know. People don't even know that you might lose your life. So the team and I thought it's important to bring to you how serious this condition is before we even begin any further discussion. Rosetta, you are welcome.
Thank you.
I'll call you out. You were late. But I'm glad you are here now.
But I'm always on time.
You are always on time. That's why I'm not angry with you.
Definitely there was
and you look good as always.
Thank you.
Let me come to you. When it comes to childbirth, I've heard discussions among women that when you don't space your children, when you put a lot of pressure on your breast when it comes to milk production, you are predisposed to breast cancer. How true is that?
If you don't space your children.
Yeah, if your breast is always in the process of making, okay, so there was this friend of mine who was talking about, she has had miscarriages back to back to back, and it looked like the breast was always engorged. So she was advised that she might be predisposed to breast cancer. How true is that?
Okay, so to start with, I would want to greet our listeners. I'm so sorry for coming late. When it comes to breast cancer, okay, so the more babies you make, your tendencies are rather lowered.
Okay.
But in the other way around, you are prone to cervical cancer if you are making more babies. But with the breast, your tendencies goes down. And the reason is because you know that in every woman at that time of the month where we are waiting for our menstruation, we tend to get heavy breasts, you know. So it's a hormonal activity. So whereby pregnancy sets in, you know, the body is preparing our bodies to meet a new baby or like for pregnancy. But because pregnancy doesn't happen, then it comes out as menstruation. That's what we see. Yeah. So in that process of these hormones acting on the breast all the time and then involuting into the body again, you are proning yourself into breast cancer. But the moment there is pregnancy, there is this break. So there is a gap for the breast to rest from all these hormonal activities. So then it lowers your tendencies, because we know that when it comes to breast cancer, it's a hormonal something. It's the hormones. As much as we are talking about the cells, these abnormalities happen within the cells because of the hormones, and most especially the estrogen. So if you are a woman and you are making more babies, your tendencies of getting breast cancer actually is very lower, but not the other way around.
Yeah. So being it having more babies, having miscarriages, which is no fault of any woman, I feel like we don't hammer that a lot.
All right, so when it comes to miscarriages, okay, because with miscarriage, the process of the breast getting engorged and all of that are also hormonal activities. And then you don't put forth to a baby. Definitely when you give birth, a baby will have to suckle for the breast milk to come out. And that suckling reflex and the suckling process itself, the breastfeeding of the baby, also takes you away from your breast being engorged and like going through all those hormonal activities. There is a break. Okay. So that is also one major reason why it lowers your tendencies of getting it. But then, if the breast is so engorged and the hormones are still activating on the breast, then there is a tendency of you getting it. So if you have the miscarriage and, you know, the breast milk is so there, and then no baby is suckling it out, but then you have been given some medications and all of that, it doesn't mean that if you get miscarriage, I'm not trying to say that if you get miscarriage, you will be getting breast cancer. Yeah. But it's everything settled with hormones. So whereby there is no way the hormones are able to get out of the system, you know, your tendencies of getting it is high.
Okay, so in that case, what does a woman do? Do I have to go to the hospital, or I can just manipulate it at home and be fine?
All right, so when you have breast milk and you want to bring it out without a baby, it's easier. Now we have the breast pump where you can bring them out. We have even people who are able to, their partners are able to bring the thing out. And we have medications that we can give you to help, you know, release the breast from being engorged and the milk disappearing small, you know, lowering it. So, yeah.
Sorry, I'm on you, because doctor has been doing all the talking.
I'm here.
Also, we're taking your pretty time. You look good, so I forgive you. But there has also been, we've debunked one myth that if you give birth to a lot of children, you might be, you said that is not true.
No, it's the other way around.
What the situation is. Wearing of bra. 13th October is even no bra day.
Of course.
But then there is this assertion out there that if you wear a lot of bra, you are predisposed to breast cancer. True or myth?
Okay, so it could be a myth, but then some way, somehow, there's a truth in it. And I wouldn't want to put it in one way. That's why I'm going all two ways. Yeah. So where you put the bra, you know, with the bra, we have different types of bras. We have the ones with the silicone, we have the ones with these liners that are there.
The metal
liners. And all of these things put pressure on your breast. So at least there should be some space for the breast to breathe. That is why we have the 13th of October where we say no bra day. At least as a woman, you shouldn't be putting on too much pressure on the breast area. Because the more you do it, that thing alone can give you chest pain and other things apart from the breast cancer. So this silicone thing, you know, you putting it on all the time, like it gets into the body and it can affect you. But then it's not a direct something that is going to cause a cancer, but it's not going to help you as a woman.
Okay.
Because as a woman, at least 8 hours in a day, you have to put on the bra. And let's learn to put on braces that are just holding on, like making us dress nicely
Giving
or neatly,
support.
just giving a support, but not to hip up the breast. In the, you know, in the quest to hip up your breast, you do all of that, and you damage your own self in the process.
Right, right. Doc, let me come back to you.
Yeah, sure.
Let's go back to, you were on why you might die if breast cancer is not detected and treated early in you. But what if it is detected early? What is the treatment like? Take us through the treatment process.
Right. If it's detected early, then we're looking at perhaps stage 1 or thereabouts. Then in this case, we say early detection means it is confined. You know, the breast is an organ, and then it's confined to that organ. Then again, to the extent to which it is confined, if it is really well confined, circumscribed, and it's not infiltrating around, then you know, that lump can just be, we call it lumpectomy, which means just removal of the lump. And then, of course, always sent for analysis. In some situations, we also remove the glands, because we know that breast cancer, one of the earliest places it goes to is the lymph nodes, which are the glands in the around in the armpit area. So then a decision can be made either to remove all the glands in the armpit, depending on the aggression or aggressiveness of the cancer subtype, because you would have done a biopsy before doing that, so a tiny piece to get the accurate, because there are different types of the breast cancer to get the exact type.
I see
and the
stage
behavior.
1, stage 2 on the screen.
Yeah.
So stage 1, the tumor is just one small over
Yes,
there.
one small confined to the breast, and it's not gone infiltrated any other tissues.
And stage 2 is just...
The principles of cancer spread is stage 2, then it's beginning to move further away into that gland.
Yeah.
Then, stage 3 then means it's going to infiltrating other structures around the breast
You
and
can
deeper.
see that
And
in
then
stage
4,
it's
it's gone further to other organs, like we mentioned.
So when we say early detection, is it stage 1 and 2 or only stage 1?
Well, stage 1 and maybe perhaps 2 as well.
Okay.
Of course, depending on the type of, or we call it subtype, because the breast is made up of various tissues. So depending on which type and the aggression or aggressiveness of the cancer, because sometimes it may be well confined and you think, okay, it's early, but quite aggressive. That one has got a tendency to spread fast. So it may be there, but it's gone perhaps into the glands already.
Yeah.
So yeah, so when we talk about early, when it's really confined, then just removal of the lump may be all that may be necessary. And then if, depending on what it is, if the glands also need to be removed, then again, you need to, and a decision will be made whether just, one, what you call a sentinel node or one gland can be removed, or we'll remove all the glands in the armpit.
Yeah.
And then the breast is preserved and life goes on. And of course, in some situations too, the breast can be preserved, all right. But still, if this cancer has a high tendency, then we can still give other treatment like, radiotherapy or hormonal therapy to prevent recurrence or spread.
It's interesting we are having this discussion because words on the streets are not what you get when you speak to professionals or you go to a hospital, because you get people saying, even if they detect it early and they take the lump out, you are still not free. That is because the cancer is an aggressive one, and so you might need other, just as Doc has explained. So it's important for you to speak to a professional, do the right test, and then know where you stand. And if it becomes necessary for your breast to be taken off, it's not the end of the world. You have life. It's more important than any other thing. So let's just do what is best and safe for us. Rosetta, let me come to you. Doc, Doc and I were just talking about why it's important and how important it is for us to detect it early. As a woman, because the doc also mentioned that the moment you start seeing symptoms, you are at the advanced stage. Early stages, how do I know that I have breast cancer?
Okay, so just like Doc has mentioned, we actually don't look out for symptoms, because the moment you see the symptoms, it means the person has already aggravated into a stage where, or the cancer has taken effect and is actually going viral, like it's going on too much. So as a woman, like doctor said, we have types of breast cancer, and this is because we have cells that produces milk, we have cells that carries the milk, like the anatomy of the breast. We have different type of things and corners inside the breast, and depending on where it is the cancer is being situated or located, that is, it would depend on the kind of treatment that you will be given. So when you are a woman, you always have to look out for your breasts. You know, the breast is so prominent, it's sitting in front of us. So it's something that we shouldn't wait for someone else, not even your partner, to come tell you that one breast is becoming bigger than the other one. You know, naturally the breast has one or all parts of the body where we have two. Definitely one is going to be a little bigger than the other one, or when it comes to the breast, the situation, one definitely is going to be lower than the other one. You can't have it in an equal distance. So in that regards, if you realize that this one that used to be the smaller one or quite little is now getting sizable with the other one, or both of them are getting, and you are not at that time of the month, it's not that you are putting on weight, then it means that, you know, you have to look out for a professional to see exactly what is happening in the breast. And we teach them how to do the palpation in the house, self-breast examination. Whenever you are breast examining yourself, or even a professional is doing it, we have to pay attention to the axilla, that is the armpit area where doctor was mentioning. So if we are looking at the armpit area, what are you looking for? The breast actually starts from the armpit area. So if you are doing it in the house and you just hold the breast around the nipple area, you know, you have to go back into the armpit and then palpate or press deep from within the armpit and then bring it into the breast area. So you are looking for a lump, because in breast cancers, they normally start from the armpit area. That is where and people don't pay attention to that side. And that is where you find yourself wanting. So it's important that they look out for that. And then much screening. You have to be doing a lot of the screening. The moment you see any difference, you have to see a professional. Because if you don't screen yourself, or if you don't you don't indulge yourself in the screening, most especially in this month of October, because we have facilities who have reduced their prices and doing things on discounts.
And
mammograms
for free.
Yes, people are doing it for free, and mammograms have been given on discounts. Okay, so like Mary Lucy Hospital like this, they are doing 30% discounts on mammogram. It's perfect. It's that time of the month. Somebody was asking, why is it that when it comes to prostate cancer, when it comes to other things, we only have maybe a day to talk about this, but when it comes to breast cancer, we are taking the whole month for it. Yes, it's very important. It's very, very important. It's the most leading cause of cancer that is killing our women here in Africa, and even more in the outside countries. So as a woman, the moment you start seeing the signs and symptoms, you're already, like, it means you have to rush as soon as possible. And some of these signs are, you know, dimple. When you have dimple on the breast, and you realize that, why do I have sudden dimple? Because dimples are supposed to be here. So the moment you see a dimple, then it means that the cell, there is a breakdown in one of the cells, or something is wrong. So like, it's holding back that area of the skin that is not making the whole skin be smooth and in the normal contour. You are not seeing the normal contour of the skin. So when you raise your hand, that's why when you are doing the examination, you raise your hand. The moment you raise your hand, you realize that that thing is still deep inside and it's not lifting. It means that something is wrong somewhere. And then when you squeeze the nipple area and you are not breastfeeding, you are not lactating, like you are not doing, you are not a mother, you have not miscarried or any kind of thing, then you see that there is this kind of milk or any form of fluid coming out of it, not in a milk form, but brownish or in a bloody form, any rusted discharge coming from the breast, you have to rush as soon as possible. Sometimes too, you see when you put an orange down, you realize that as a achonchom, it gets that kind of thing. So that kind of, we call it pet de orange in French, but then it's in breast cancer, we look out for that. So when you have that thing around the breast area, as it's hormone, you know, and it's crumpled, that kind of crumpling, that's the word. Then you have to look out for a doctor to see. And sometimes the lump is the most important thing we look out for, one major thing we look out for. And then there are sometimes too, you may not find a lump, but there is some hardness. People also tend to get sores around the breast. People get sores around the breast. It gets so nasty. And so the moment you see some of these signs and symptoms, then it means it has already taken effect. But sometimes, not all lumps are breast cancer. Let's say it's here. So the moment somebody is palpating you, oh, we've seen a lump, don't get so carried away and then kill yourself, go and stay indoors and say, oh, I'm depressed.
The best thing to do is go to a hospital to
of course, to see which kind of lump it is. Okay, because not all lumps are related to breast cancer. So we have to let our people know. And then, so when you see all of these things too, some of the women also think that, oh, the moment I go, they palpate and they've seen a lump, then my breast will be cut off. It doesn't just work like that. So it would depend on the stage of which the cancer has gotten to and how fast it's traveling within your system. And then if the need be that we do that, that is where we get there. But don't just kill yourself, get anxious, depressed and all of that and stay home. And because of that, you won't come out for screening. So we should be doing often screening and look out ourselves for the breast.
I agree with Rosetta. Breast cancer diagnosis is not the end of the world. So when you find a lump, go to the hospital. Don't stay in the house with it. Go to the hospital, speak to a professional, know what is happening to your breast, know what is happening to your body. Where are you? What are the options? Can we do this? Can we speak to your health professionals? And I think a better option will be selected for you. My name is Ethel Poplampo. The show is called Living Well. We'll be right back from this break. Right, welcome back and thank you very much for staying. We'll be announcing our WhatsApp number shortly so you can join the discussion. But right now, let's take a story. We'll be right back.
Breast cancer is the most important invasive cancer in women and the main second cause of cancer death in women after lung cancer. In Ghana, where over 4,000 women are diagnosed with breast cancer annually, almost half of them will die. A study in 2022 showed that women in Ghana are diagnosed at more advanced stages of the disease. Up to 70% of women have advanced stage cancer by the time it is identified. Here are some key points about breast cancer in this report. The first symptoms of breast cancer are usually an area of thickened tissue in the breast or a lump in the breast or in the armpits. Pitting or redness of the skin of the breast, like the skin of an orange. A rash around or on one of the nipples. A discharge from a nipple, possibly containing blood. A sunken or inverted nipple. A change in the size or shape of the breast. Paling, flaking or scaling of the skin on the breast or nipple. After puberty, a woman's breast consists of fats, connective tissue, and thousands of lobules, tissue glands that produce milk for breastfeeding. Tiny tubes or ducts carry the milk towards the nipple. Breast cancer usually starts in the inner lining of the milk ducts that supply them with milk. From there, it can spread to another part of the body. The risk increases with age
At 20 years, the chance of developing breast cancer in the next decade is 0.6%. By the age of 70 years, this figure goes up to 3.84%. Being exposed to estrogen for a longer period appears to increase the risk of breast cancer. Breastfeeding, especially for over 1 year, appears to reduce the chance of developing breast cancer, possibly because pregnancy followed by breastfeeding reduces exposure to estrogen. Women with cosmetic breast implants who are diagnosed with breast cancer have a higher risk of dying from the disease and a 25% higher chance of being diagnosed at a later stage compared with women without implants. This could be due to the implants masking cancer during screening, or because the implants bring about changes in breast tissues. What are the treatment of breast cancer? Treatment of breast cancer depends on the type of breast cancer, the stage of the cancer, sensitivity to hormones, the patient's age, overall health, and preferences. Remember, there is no sure way to prevent breast cancer, but some lifestyle decisions can significantly reduce the risk of breast and other types of cancer.
There you have it. Most of the things mentioned in the story, my guests have done justice to them. And we are still here talking about breast cancer and the fatalities that come with it. You can join the discussion by sending us your WhatsApp messages on 055 00 90 647. Please don't call the number. Just send us a text, WhatsApp, on 055 00 90 647. It's actually on your screen. Don't forget to add your name and where you are texting us from. If you just joined us, I've been doing the discussion with Dr. Davis and Rosetta. Doc, let me come back to you. During the break, you made mention of a myth that has been going around about the sucking of the breast to prevent. Myth or truth?
It's a myth.
Okay.
Why? Because you see, any organ that is exercised reduces risk of cancer. We know that about prostate. If you exercise, your heart health improves. But sucking is not an exercise because the breast is primarily a mammary organ, milk production organ. So the kind of thing that will exercise the breast is when breast milk is being produced and is being suckled. If it is just sucking without breast milk production, then that organ is not being exercised. So it is not true. It's not true. If I'm sure maybe the men may be disappointed.
My director is shouting in my ears.
But the other thing is, of course, the sucking involves fondling, and during the fondling, you might pick up a lump. Okay. That is a different scenario. Then, in that case, it's not because it is being sucked, but it's because it's a form of palpation or examination, basically. And if so there's something hard in your breast, then you've picked it up. So it's a myth if they say men sucking breast. Children sucking breast or breastfeeding, yes, that one is protective.
Okay, so because it's a mammary gland, the milk production and the sucking by babies, because milk are meant for babies, that, yes. But then if the gland is not producing any milk, you're just sucking, there's no prevention, unless there's fondling that you might pick up. Rosetta, do you have, I know you want to, Rosetta, I want to hear what you have to say.
All right, so Doc have disappointed our men out there this morning, but that is the truth. And then, but then I would want to support the men in a little way, So in the process of suckling, like Doc said, that's where you are able to detect if there are any abnormalities. Yeah. So the same way, if you are suckling and there is this kind of fluid coming out, definitely you also get to know.
Rosetta, that's
I like this.
That's a prevention, okay? Yeah. Like he said, that's not a medium of prevention.
Yeah.
Okay, but then it's a medium to detect.
Yeah,
So we the men, we the women, we are so happy because we enjoy the suckling and then the fondling and all of that. And that is why when we talk about the fondling and the suckling, we want the men to do more of it.
Yeah.
And because we enjoy it, why not? If you are doing it and in the process you get to know that there is this fluid coming out which is abnormal, or I've detected something, some hardness in the breast or something, you know, so you have to know the in and out of your woman's breasts. You have to know all the anatomy, the diagonal, you know. So the moment there is this change, then you pick it up as soon as possible. So as for the suckling, then we beg you, suck for us, okay? Suck the milk for us.
Right. Can I just comment a little point here?
Yeah.
There's a difference between suckling and sucking.
Okay.
Men suck, the babies
suckle.
The suckle that is advantageous.
But the
The
sucking.
sucking there, unless collaterally you pick up something. Then
But Rosetta, how has you worked directly with
Women.
You also mentioned that with the sucking, not suckling, with the sucking, if the man detects any abnormal fluid, then there is a cause for alarm. We are also aware that after breastfeeding, the milk just don't go away. It will take time for everything. So at what point is it a cause of worry for a woman who has stopped breastfeeding? Because it takes quite some time for everything to stop. So when should I be worried if I just finish, I've finished breastfeeding? What is the time frame for me to stop seeing fluid coming out of my breast?
Okay, so breastfeeding and breast milk comes with engorgement of the breast. So the moment the breast begins to, you know, like wane away, the breast milk is waning away and the breast is becoming lighter, you are getting back your normal breast. There is no milk coming out again because baby is not latching on it. And then it takes you like some time, you realize that, oh, okay, so normally we preach that when you give birth, at least a 2.5 year, you have to breastfeed your baby. But that doesn't mean that that is the duration for breast milk. Because one thing about breast production is where there is no suckling, the body has its own of getting rid of it naturally. The body has, apart from you bringing some out, the body has its own of telling you if there is no baby suckling. That is why when women deliver or put to bed, we tell them that put the baby to breast as soon as possible. People will be complaining, most of my women will be complaining, maybe the baby is not latching well or baby is not suckling well. And that suckling reflex actually pulls the breast milk to come out. Okay, that then is needed for the milk production, like the milk to come out. Until it is done well, the milk won't come out. So whereby no baby is suckling on this breast, and then it has to find a way. We have medications we give to the women who are trying to stop breastfeeding and all of that. And the breast is not engorged. We have babies who go on breast strike. You give birth 3 months, baby tells you, I don't want breast milk again, no matter what you do. You put the baby to breast, no way you put baby to breast, the baby will take their mouth away.
Right.
In a few time, like in about a month or two, you realize that the breast production will start diminishing. It goes down.
Because some women I've spoken to say, even though the milk after weaning, even though the milk is not flowing regularly, you still see elements and then the color changes before everything goes away. So is there a duration that maybe when you stop weaning, after 6 months, everything should clear? So anything I see after that 6 months, I have to be worried about it. Is there a time
I
duration?
can't say there is this specific duration, except doctor would want to bring some substantial information about that. But with what I know, if you are not breastfeeding, it takes like the milk production it subdues. So the moment there is no this suckling reflex, you know, it gets away on its own.
Yeah.
But it depends on the hormonal activity of your system. Because the prolactin or the milk production hormone, some people have it in abundance, others don't really have it. That is why you have two mothers giving birth, and one is having a lot of breast milk, and the other is struggling to get breast milk.
Right.
Regardless the breast size.
Right.
So
There's
actually,
no
it
specific-
tends to depend on the individuality, your hormonal activities, and how they are reacting to the system.
Okay.
But the moment baby stops suckling, it shouldn't take like more than 6 months. 6 months is too long.
Okay.
For the milk to diminish. Because that suckling reflex will no longer be there, and the body will have to find its way of getting back to itself.
Right.
So I think doctor should add on to this one.
Right, Doc,
really
you will add on to that, Doc, but then there are some questions coming in that I'll read to you for you to help me. And this is from Belinda from Sakumono. She says, hi, good morning. Please, my question is, at what age does a woman likely get breast cancer? I hear people say entry into menopause is when most get it. I think Doc has answered that question. So Doc said it is during menopause, but then he will touch on it again. And then this one is from Rosemary from the fertility group. She says, hello, please, I've heard and observed as well that women with issues in their marriage, that's marital problems, and serious financial issues are prone to getting breast cancer. How true is that?
All right. This very question first.
Yeah, Rosemary.
Right. Well, if there are issues, that is stress, isn't it? It brings a lot of stress on the body. And anything that brings stress or any form of stress on the body increases when an individual's likelihood or makes the person susceptible to these conditions. You see, the center of our healing, aging, is our immune system. And what controls the immune system is our stem cells. Every organ tissue has got stem cells. So if there is stress and other things, then our stem cells, the immune system can be affected. Our stem cells don't work as well as they should. And then that can predispose to some of these things that we're talking about here. And stress can cause a lot of hormonal imbalances. We've just said that hormones, particularly is a type of hormone we call estrogen, and to an extent progesterone, contribute to, they are the main hormonal influences of the breast.
Okay.
So can predispose to
now,
breast
Belinda's
cancer.
question, even though you've answered it, and maybe she just joined, so about what age, at what age?
Yes. Worldwide, we'll say, when women are around the menopause, which is around 50 and beyond. As we said, because of the prolonged effect of repeated cycles of hormonal influence. But there has been a trend towards the low, middle developing country that women, that age drops, about 40s going, becomes an issue. So in our part of the world, the age is a bit less than.
Okay.
Yes. I don't know whether genetics has got a role to play in this, or our, type of lifestyle is all contributing to this, because people are now leading, people are now, Western type lifestyle. And so we are importing, diseases onto ourselves. Yes. So yes, in our part of the world, younger age, screening, I'm sure, also has a role to play in all this, because they get screened from 40. So if there's even a tiny lump, it's sorted out, but we don't get it done. And so these are all factors that play.
Right.
I would want to say something.
Yeah, sure. And to add, okay, you finish.
So we have 18 years. I've seen a 14-year with breast cancer. So the thing is, if you have the gene, we always say that if there is anybody or in your lineage, your mother, paternal, maternal side, who have ever had any form of cancer before, then your chances of getting breast cancer or any other cancer is very high. So if it's in your genes, then if we don't test and see that you have it, your tendencies of getting it is high, then depending on how your immunity responds to it, there are chances of you developing it regardless the age.
But are there tests you can run to show that you
The
are
genes.
prone to breast cancer?
Yeah, in the Western world, in here, I don't know in Ghana if there is any facility that is doing that. I don't think it's easily accessible in Ghana. But I know that in the Western world, you can test to see your genes. If you have seen that a family member have ever had it, you can test to see if you have that then in your genes. That is there. Right. So if you have it in your genes, then regardless the age, if your system doesn't support you, and you also don't help yourself, like doctor is saying, you know, back in the days where our mothers and our grandmothers, they used to do a lot of exercising, they used to work, you know, manually, walking a lot and all of that. But now, here and here, we just want to sit in a car. We are driving here and there. We have the Bolts and the Ubers and everything. Yes, we don't go there.
Rosetta, I'm coming for you today a lot.
All right, so I had to work anyway upstairs here, and I was fighting. You see, so those are one of the things. Yeah. Because we are now making our life so easier, and we don't tend to do a lot of exercises. So if you are not doing all of this, and you have it in your genes, or even if you don't have it in your genes, and you are born as a woman, yeah, there's this hormonal fluctuations in a woman. So now, regardless your age, and the smoking.
Because now, when we projected my producers could just project it one more time. When we're talking about the stages of breast cancer, we could see some of the points that Doc already made: hereditary, diabetes, just as you see, age. That is where the menopause comes in. I think Rosetta has touched on the pregnancy and breastfeeding bit of it. How pregnancy and breastfeeding don't cause breast cancer necessarily, but then you can go back and watch the whole show on Facebook, and then you can get back to what Rosetta said about. And then the hormones has been hammered a lot. We do understand how the hormones also work. And then I think the only lifestyle, as Rosetta was saying,
like, you know, the shishas, I want to stress on this one, like emphasize, because, you know, now smoking has become very habitual and common amongst our team. It's trending. You know, you go to parties, you go to programs, you go out in the night and realize that 13 years, 14 years, 17 years, they're out there amongst their friends. And because of this shisha, introduction of shisha in Ghana, these little ones or these young girls, you know, everybody they are just smoking.
Apart from even smoking, it's just, I know today we are not talking about drug abuse, but it's just how innovative they are with taking drugs. I just recently found out that the balloons they've been holding actually contain drugs. I thought, okay, we at the club we are holding balloon, a celebration, not knowing what is in the. What are we doing? Why do you put yourself?
You know, this shisha thing, I will sit on your, I'll use your platform to say that I don't know what the government and the ministry is doing about all of this, because the shisha is taking away, you know, if we don't take care, in the next 5-10 years to come, it's going to be so terrible.
Because I'm just getting to find out that
it's going to be terrible.
Take girls actually with the mentality that if you smoke, you lose weight.
Can you imagine?
But let's not go into
all of those things can prone you into getting the breast cancer.
So Belinda, if you are listening, apart from menopause, also your lifestyle, hereditary, hormones, hypertension,
early menstruation, or early menopause. If you get your menopause in an early stage, your tendencies is high. And then if you don't give birth early, if you delay in giving birth, your tendencies is high, because you know you will be doing a whole lot of the first thing I said, where your hormones, you get your breast engorged, it goes back, you ovulate, it goes back, you menstruate, you know, that kind of influctuations with your system. Right. So your tendencies of getting breast cancer is high. Right. But if you give birth early, at an early stage, your tendencies is low.
Rosetta, since I've known you, you are, when it comes to advocacy for women and children, you come to mind first. But then let me put this to you. How can we as individuals and communities advocate and bring more awareness to breast cancer? Because you said that people complain about, oh, why is there a whole month dedicated to breast cancer? I've also had people ask me, why is it only in October that we talk about breast cancer? We should be talking about this all the time. So as individuals, how do we play a role for everybody to understand that this is life-threatening, this is fatal, this will not only make you lose your breast, you can lose your life. And if your family is losing somebody like you, you think you are gone, but then the whole family is being affected by this. So how do we as individuals first and communities bring awareness to the fact that breast cancer is just more than losing your breast?
All right, so individuals, I'll start with the partners. If you're a boyfriend or a boyfriend and you are watching us, it starts from you because you are the direct, apart from the woman with the breast sitting in front of her, you are the next person that has access to the breast. So you have to do justice to the breast and do it well. You have to make sure that the fondling, and there are some men, they will not even hold they won't touch the breast. They won't even touch the breast. As much as some of them make noise about the breast, we also have people who don't actually have that energy to come and, you know, put you in the mood. So it's very important that that part of the sexual thing is done so that you get to know your woman's breast, you know, the in and out of the breast, so that if there are any changes, you detect them early. And then when it comes to the communities, we shouldn't always wait for the healthcare givers like us to come out to the community that we want to do this and we want to help the community. You know, if you are, me, I'm coming from the Nungwa environs. That's where my workplace is situated. So if you are a Wulomo, you are a Ken, you are a Queen mother, you know, there are certain days that you have to rather chase the healthcare givers and then approach them. Oh, we are a group of women, would want you that, oh, we have a market day, which is always Tuesday. Can you do at least in a month, one Tuesday for us? It becomes a beautiful thing. It means that you're also concerned about your people. But there are certain times that we have put it upon ourselves to do this thing. You go out there and they even don't give you the support. So when we come to, they should support us in every given way they can, and then make sure they help us to mobilize their people so that we can talk to them. So it starts from the bedroom, the partner, and in the community, everybody is also, if you're a mother, your girl child, you have to be looking out for them, most especially if there is anybody with a trace of breast cancer in the family. Then if you are a mother in such a family, your girl children, you have to pay much attention to them and be doing regular screenings for them.
Right. You're still watching Living Well. We are talking about how fatal breast cancer is. I think my notes and takeaways from this discussion so far is keep your eyes open on your body as a woman. When you see changes in your breast area, speak to a professional. Speak to a health professional. Don't discuss it with your friend who will say, oh, they also had the you see a lump. Not every lump means breast cancer, but speak to a professional. Be sure and go out there, get screened, and just be each other's keeper. I think we should make it normal to go and talk to a health professional about how you are feeling and what is wrong with you. Yes, sometimes the health professionals are not that friendly, but I think if it becomes a culture, they will also adjust to the fact that anybody can just walk up to me and ask me questions about the way I'm feeling. We are about to wrap up just in 2 minutes, but there's some questions that I'll pick. If I'm not able to pick your question, sorry. We will continue. The discussion is all month, so we'll continue next week. But Doc, this is from Gifty. She says, hello. Please, my question is, can breast cancer be cured rather than for it to be taken off? I know you've answered this question already, but 1 minute.
Yes, if it's detected in a very early stage, then yes, it can be cured. Now, that detection can come either through self-examination, but most importantly, screening programs. Yes, they can pick it up. And that's the whole point of screening. So you can pick it up early so the person can survive the cancer.
But I think Gifty's point is, why should we take the breast off if we can?
Again, it depends on the stage, several factors. The stage, aggressiveness, what we call receptor status, because there are different subtypes of cancer. So all those will be factored in to make a decision.
Okay, so Rosetta, Gifty, the part 2 of Gifty's question also is, assuming if I don't have a boyfriend or husband, how do we massage it?
So when you want to massage it, you always have to stand in a mirror. Apart from the massaging, you stand in a mirror and then you raise one of your hand, put one here, and then you raise one hand. That is where you assess the size of the breast. You always have to look in the mirror to see the size of the breast. You always have to squeeze the breast to see if there is any fluid. And then the massaging, you lie down, you put one hand beneath your head, and then you use the middle index fingers to massage from the armpit area. You press deep, and then you rotate yourself. So when you are done with right, you go to left. That is how you do it in the house.
Rosetta, you are doing amazing on social media. So if you want to join Rosetta's health advocacy programs on social media, Rosetta, where can we find you?
So you can find me on all social media platforms, TikTok, Facebook, Instagram. I tell it to Rosette. Tell it to me. I'm Rosetta, so Rosette. So tell it to Rosette.
Right.
And then Mary Lucy Hospital as well. Mary Lucy Hospital and Fertility Center. You can find them on all social media platforms. They do IVF and they do a whole lot of things, plastic surgery and all of that. Okay. Anything you are battling with stem cell, they are there to help you.
And tell it to Rosette. Just tell it to her. She's a nice person. Forget
hey, please, my beautiful, nice makeup is by one nurse at my facility.
Right, my time is up. Rosetta, you come again.
She's Tina. Okay, so Tina, thank you. I love you so much for the
Doc, your final words. 30 seconds.
Right. Breast cancer is a killer.
Right.
It is the #1 cancer. We cannot prevent it, but we can detect it early. Right. And the onus is on the individual. You, the individual, have a big role to play. If you cultivate the habit of examining your own breast once a month at certain times of the cycle, preferably times, when about day 3 to day 5 of your menstrual cycle, when it is less tender and less lumpy. Examine your breast on a regular basis, cultivate that habit. So if there's a lump or anything coming in, you will be the first person to note and detect it. Right. And that can be prevented.
Thank you
and you
very
will end up
much.
not losing your breast or your life.
Thank you very much, lady.
And let the men know that they can also get breast cancer.
Yes, men can also get breast cancer. Yeah. And Doc has emphasized that. Thank you, ladies and gentlemen, for coming in. As you can see, breast cancer is very wide and broad, and so we'll be talking about it the whole of this month. So stick and stay. And I'm so sorry to those I couldn't pick their questions. Next week we'll go again, and I'm sure next week I'll take your questions. My name is Ethel Poplampo. The show is called Living Well. We are back again on Saturday. Good afternoon.